welcome to DBL. We've got the one and only Dr. Coley joining us. Thank you, Dr. Coley, because we need to talk to you. This is very, very important, and we're so glad you're here. Okay, we want to get your reaction to some pretty major news. The Surgeon General declared gun violence a public health crisis today. He called on the nation to address the issue that kills more than 48,000 Americans every year and continues to grow. It's also the leading cause of death for kids. He said, quote, "I want people to understand the full impact of firearm violence in our country, and I want them to see it as a public health issue." So this is what he's calling for: a ban on automatic rifles, universal background checks, and for laws that would restrict their use in public spaces as well as penalties for people who do not store them safely. So Dr. Coley, you know that this has kind of been like my passion project. A lot of people don't see this as a public health issue. As a doctor, what would you say?
I think that's ridiculous. I mean, I'm not speaking just for myself as a physician. I'm speaking for the American Medical Association, the American Association of Pediatrics, and at least a dozen other medical societies, public health societies that are all saying this is a public health issue. In fact, it should have been made a public health issue 4 years ago when the report first came out that now gun violence is killing more kids than car accidents. So why we're doing it today, I'm not sure. It's a long time overdue, but I'm just glad that it's finally here.
Were you surprised at the lack of reaction from that the guns are killing? Because when you say anything about kids in terms of, you know, these online people going after pedophiles and people, that, like, it galvanizes an army of people. But when you say guns are killing more kids than anything else, people are like, oh, it's interesting. It's fun fact.
No, they'll actually debate you because I've gone door to door.
Oh, you mean they don't believe you?
People the statistics and they gaslight me and they tell me that's not true.
Oh, they don't believe.
And I have an agenda. So, in fact, I have a documentary coming up July 9th here in Denver called Up in Arms at the Sci Film Center. Please come join me. I will be there.
We are so proud of you.
So, yeah.
Unbelievable.
Go ahead.
Let me ask you this, though. Talking about this going into politics, the majority of the United States, whether Republican or Democrat, a strong majority believe in common sense gun laws, like he wants to do. So, will making this a public health issue make it less political somehow?
I think what it will do is put a medical spotlight on this. Now, what I'm hoping it'll do is more research, more funding, more surveillance, more advocacy.
Right, and it comes down to the Congress.
But the bottleneck here, guys, is really our politicians. Yeah. And I wish, and you know, back when I was in medical school, one of the questions we used to ask our patients, do you have a gun at home? And do you know how to use it safely? And that's gone now. When is the last time your doctor asked you that?
You haven't.
It hasn't,
no.
Despite the fact that we have statistics like this, that they're killing more kids than car accidents. So I really think at the end of the day, it comes down to the politicians. But I think the more we can push this as a medical issue, which it is.
Right.
I mean, my job as a physician is to save life, is to protect the sanctity of life. And that's what guns are taking away, not just from us, but from our kids.
Well, I wonder if you've already answered the question, but do you think that these Surgeon General's suggestions are going to result in the real final outcome, less deaths?
Well, I think it's a step in the right direction, because if he's talking about banning assault weapons, and we know that assault weapons are involved in 27% of mass shootings, and that's what causes more casualties, right? If A equals B and B equals C, then A equals C, right? And
transitive property.
Yes, thank you.
It's true.
Good job,
PhD
Tor.
mathematics now, right?
Jeff and I have no idea what that means, so we're just smiling like, yeah, transitive property.
I wasn't listening the whole time. No, I'm kidding. We're going to switch gears here, okay, Doc? Sunday was the biggest travel day ever. So 3 million Americans passed through airports, and this 4th of July holiday is predicted to be, or this 4th of July, the busiest ever. So what happens to your body while you fly, and what should people know when they're flying this weekend?
Yeah, our body wasn't designed to sit in a little tube and go at 500 miles an hour at 30,000 feet. So a lot of weird things happen to our body. So first, our heart rate goes up. And so our cardiac demand goes up. We're breathing a little differently, so we actually get more dehydrated. There's less air in the atmosphere, less water in the atmosphere as well, so that dehydrates us. And then on top of that, we're sitting. So the blood is pooling in our legs. So we have increased risk for blood clots. And this is something, unfortunately, I've experienced personally. You guys have too. The gas in our stomach expands. So my neighbor sitting next to me.
Oh, please. No, but I do get angry, and I angrily turn on the air thing to let the person know I know what you just did.
But how do you know which person it is? Sometimes you're like, is it from the front? Is it from the side? You know? And it's a physiologic thing. It's our body is designed to give off more gas.
But get a hold of yourself. You're an adult. You're in a contained area.
How do you get a hold of it? I'm not saying.
So it's Tori.
No, it's no.
You really are an advocate for the people.
I know. Oh my God. Someone once brought barbecue on, and then the rest of the flight.
Okay. All right.
Let's talk about something a little bit happier. Cocktails. When you're on a flight, sometimes you imbibe.
Yes.
Okay. Is that a good idea? Not a good idea?
So think about all the things I just said. You're a little more dehydrated. So what does alcohol do? It dehydrates you even more. So it increases your risk of blood clots, and it increases all of the heartburn and all the dry skin, dry mouth, dry eyes, dry nose, all the things that's going to happen. We think sometimes it'll help us relax, but what it actually does is it increases our heart rate more. So for people who have heart disease, it can actually trigger more cardiovascular strain. And for people who have neurological disease, you could even have a seizure. I had a lady on a plane that had a seizure next to me.
Me too.
Right next to you?
Next to me, because she had too much. She had 2 cocktails.
How did you intervene?
But they have all the equipment on board and
I did it
everything, so
too.
you stabilize them.
Tori wants you to know that she did it too.
She is literally over talking a doctor talking about saving somebody's life.
I did
Dr.
too.
Coley, can you be quiet so Tori can tell her story?
No, I was just saying.
Okay.
I also saw it happen.
Dr. Coley, what? Because if it's going to happen to you, don't you want to be sitting next to Dr.
Absolutely.
Coley?
That's what I was
I want to
thinking.
sit next to Tori.
Thank you. I did the oxygen mask. I made sure she was okay. We made sure her teeth were. We didn't adjust her too much. We found her epilepsy pills.
Did anyone ask if you're a doctor?
Yes.
Not one, but
they
I got
did-
$200.
But on the way out, they did start saluting her and said,
saluted
"Thank
me.
you, nurse. Thank you, nurse."
Yep. Yeah.
I think you had a lot to drink.
I
on that
didn't. It
flight.
started before the plane took off, so you're wrong.
Catch me if you can. She's lying about her profession.
Saved her life.
You
Saved her
hope
life.
that you sit next to Dr. Coley.
I
And
don't
me.
drink on those flights.
That's right.
Yeah, good job, Dr.
Tori.
Coley. Thank you for joining us. As always, DBL Nation, follow Dr. Coley on social media at Pyle Coley MD. Also, be sure to subscribe to her YouTube page and check out her podcast, Heart of Medicine, wherever you listen to your podcasts. Thanks again, Doc. Appreciate you.